Hey everybody, it is Jason, and today, to the date, I am 2 months post-op. It seems so weird to be saying that. There's like 2 whole months since I had the op, and like obviously things are still healing up, but so much has happened to it, and it's just amazing. But I suppose you want to see everything, especially as I didn't show anything on the stream, so here we go. Yeah. So this is what it looks like 2 months post-op. Obviously, here is the front, and there is the sides. La la la. So yeah, there's been a few updates, and again, there's been a lot of sort of ups and downs like there has been before, especially like 8 weeks versus now, which is only about maybe 5-6 days after. A lot has changed. So the first thing is with my sutures. I don't know if you could see them, so I'm gonna get up quite close. So I've got one there, which was the larger one, and then I've got another one there. So I had to put Inadine on them again because basically this one kind of reopened a bit. This one decided to drain basically after... Basically, I got this at 3 weeks post-op, and it's taken 6 weeks to actually, like, be ready to drain. But in any case, I managed to get some stuff out, and the stitches out now finally, and I put some Inadine on them for a bit, and then since then I've let them air. And they look a lot better. There's just no yellow at all now. It's all sort of nice and scabbing over and like the scars. As for the actual nipples themselves, as you can see, there are no stitches whatsoever. I don't know why I'm kind of clutching this, but yeah. So they look really, really good. I'm really, really pleased with how the nipples have turned out. They're really nice and pink. There's maybe ever so slight tiny specks of discoloration, like sort of blacker bits, especially on this bit. It's like a little tiny thing, but I don't know what that is or what to do with it really, but I don't really care. Other big thing is no microtape. So obviously, as I've said before, the microtape is for 3 months, or that's like the recommended time period that Mr. Nishaw tells you. I keep sort of shuffling around here. But basically, after the main problem with this, I did put the tape back on, and I found that actually it was causing more harm than good. I'm not getting any kind of allergic reaction or anything, but it's definitely causing the scars to look more inflamed, especially at the very edges, so like these bits here. And also, even if I'm like doing things sort of in different positions, so like I went to an escape room a couple of weeks ago and I was crawling, and there was no pain or anything like that, but it was causing the tape to sort of pull, I guess. So it was causing these sort of red strips to appear, and it's like, no, I don't want to do that. So I said to Nisha, okay, is it worth me actually still wearing it? And he said no. So now I'm actually completely tape-free, finally, of anything, and I'm doing sort of bio oil massaging now twice a day. So it's all good. I'm really, really happy with everything, and even after a couple of days of using bio oil, the scars look a bit more kind of duller, so a lot less red looking. At the minute with dog ears, so as you can see when I put my arms up like this, there's definitely like a pinch on both ends there. Now, again, because it's such early days, I don't know if it'll settle down or if that's what they're going to be like now until I potentially get a revision. I mean, at the minute, I don't really care about them because they're quite small and they're not giving me any bother or anything like that, so I might choose after 6 months if they're still there to get them removed, but I'm really not sure. The point is, though, that the ends of the scars, especially the left side, look really good. So there's not kind of any... You know how I was mentioning about the sort of sprawling, like, veiny look to them, like that? That's not a thing now, especially on the left. There's a tiny bit on the right, but not much. The drain scars are okay. They are still, though, very much there. Especially on the right side, it kind of goes in. Which aesthetically doesn't look very good, in my opinion, so I'm trying to remember to use bio oil on those bits as well. Also with the actual scars themselves, I think that the right side is a bit more kind of either stretched or inflamed compared to the left, which is looking thinner. I don't know why that is, frankly, especially because like only a couple of weeks post-op when I could start reaching things, like sort of doing that level, I was using my left side because I'm left-handed. So I don't know why that's happened, but I mean, I'm massaging my scars now, so maybe it'll break it down a bit. What I am very pleased about is Mr. Nishaw did mention there could be dog ears in the centre, but nothing of that sort has happened at all. There's a slight definition, as you can see, of my pectoral muscles, which is very nice. There is this thing about trans guys and trans masculine people wanting just an absolute flat as a pancake chest, which doesn't look natural. Whereas I very much love the idea of, okay, there's sort of a crease there which becomes like pectoral, but everything's really flat. I'm loving that. As for sensation stuff, so sensation is almost all back, especially like around the nipples it is, apart from, can you see how this bit is still like almost swollen looking? I honestly don't know if it's swollen anymore or if it's just because of the nature of like sucking out the fat and bringing up that part to the chest wall and redesigning it. Because when I touch it, I can't feel any swelling per se. It just feels like muscle tissue. But around here is definitely still quite numb. This side is absolutely fine. I can feel that, no problem. Maybe there's a little bit there that's a bit numb, but not compared to that side at all. There's also, I don't know if I've mentioned this, there's also, if I do this on my left side, like under my tricep, if I happen to rub it, I get these sort of tingling sensations along this scar. This has happened since my operation, but if I do it now, it's still there, but it's less intense, which is good because I was worried that it would be just like a permanent thing. The fact that it's dulled implies that it will eventually stop. And it's not like a problem at all. It is literally just a mild annoyance or a mild inconvenience, but still, for that to be there, it implies that there maybe is something that's happened, like maybe nerve reconnection or something. And then as for the nipples themselves, since the stitches have all come out, I can actually feel them less because, by the sounds of it, the stitches caused the sensation because they were right on the surface, whereas now when I touch them, if I just sort of stroke over them like that, it's quite difficult to feel anything except for around the edges, which is basically just more pain, which I mentioned before. If I prod them like that, then yes, I can feel them on both the left and the right. And then the nipples themselves, if you don't know, they kind of come through at about 6 months. And there's still more sort of definition on the left side as to what it will look like, but there's definitely nothing protruding. But in terms of how the nipples have healed, I am really, really happy with those. They both look really good. And they're amazing size. They're much more like they should be. That sort of smaller, sort of, you know, this size. Not fucking like this size, which is how they used to be. You know, sort of more than a golf ball type size. So I'm really, really pleased with those. So yeah, now it's just a case of bio oil every day for a while, just to kind of let the scars heal up and break down and stuff. It is a bit weird when I use it because if you've not used like scar healing stuff before, basically it causes the scars to turn white as you do it, and then they kind of come back, which is a little bit weird. But it's good that I feel like I've moved on to the next step as well mentally, because it's like, oh god, still use the tape, and whereas now it's like, actually no, I don't need to. So that's really, really good, and hopefully I won't get any more problems from these sutures. There was another suture as well, which was sort of sticking out there, like literally you could see it. It was like a little black thing. That did come out at about about 8-9 weeks post-op as well, so that came off with the tape, which is quite good actually. That was quite useful. But yeah, and today I had a bath for the first time. I'm sure I could have had a bath earlier, but I really sort of waited until I knew for definite that everything stitch-wise had come out, and that was really nice. So yeah, I can now like go swimming, obviously in a swimming pool, not like where there's like lots of sunlight, but I can go in a swimming pool, I can bathe, and just that whole thing sounds amazing. And all I have to do is just make sure I use the bio twice a day. The other things that I've experienced already just from not having chesticles anymore is incredible. Like the feeling of putting on a t-shirt every day, like before going to work, for example, is still amazing, because there's not that added thing of, oh yeah, I've got to put a binder on and make sure it sits properly and all that, which takes another good few minutes off your time. It's like, no, you can just squirt with deodorant, put it straight on, happy days, you're all ready. And it's like, it's really, it sounds like such a tiny thing, but it really is something else. And then there've been other things as well, like live streams, doing those. I don't have to get ready for them anymore. It's just like, okay, I just sit down and do it. And then the thing I'm more concerned about now with live streams is how fat I look, because I've got a bit of a belly. Not like, oh, are they visible type thing, because obviously they're not. And the weirdest thing, which I did not expect at all, I mean, it makes sense, but I just didn't expect it, is the amount I am passing more because I do not have them anymore. Especially if I'm just wearing like a t-shirt, which I'll put on back on now because I'm a bit cold. If I just have like something like this on, then people see me as male much more, I guess, because they can see that there's nothing there, like it's just flat, so therefore like the way it's shaped is obviously male, so therefore you must be male. So yeah, I really did not expect that at all. Maybe in terms of how cis people saw me, I was kind of more hopeful than I should have been. Maybe I should have been more cynical, but I guess it's a case of, oh yes, if you can see something there, then you know, you must be female and stuff. But I didn't want to minimize cis people down to the whole, oh, if you've got boobs, then you must be a woman. But apparently, yeah, that is a thing. So, but yeah, so that's also brilliant, and there's just no dysphoria anymore there at all. And that is amazing. It allows me to do more things. It allows me to do more things during the day, like different tasks, and not feel absolutely exhausted anymore. I'm sleeping better as well, although I don't know if it could be a couple of things, to be honest. Like my hours have kind of become the same every day, which is good. Annoyingly, I still can't sleep on my side very much because it still hurts a bit if I go on my sides, I guess because my bed is a bit on the hard side. But yeah, just so many things. And I think as well, I'm carrying confidence a lot better, so maybe that's also helping me to pass better. But yeah, I'm just so much more confident now that I don't have this burden that I know is always there. It's incredible how much top surgery has changed my life. But obviously I will keep you updated on how it looks and how it's going, and I know a lot of you sort of watch my videos with, you know, do I go with Nisha or do I go with somebody else? So I hope this is all helping in terms of you deciding as well, because it's important. Of course, if you want to see more of these videos, then feel free to press like, subscribe, hit the bell as well so you get notifications when I put out a new video. And I will see you all in the next one. So bye-bye.